This is what health insurance reform will mean for the average American. It will mean lower costs, more choices, and coverage you can count on. It will save you and your family money. You won't have to worry about being priced out of the market. You won't have to worry about one illness leading to your family going into financial ruin. Americans will have coverage that finally has stability and security. And Americans who don't have health insurance will finally have affordable, quality options. These are the areas where we agree right now. And this consensus has brought us closer to the goal of health insurance reform than ever before. Now we've got to get over the finish line. And part of this process is figuring out how to pay for it. I've said that health insurance reform cannot add to our deficit over the next decade, and I mean it. Let me repeat. Health insurance reform cannot add to our deficit over the next decade, and I mean it. Already, Congress has embraced our proposal to cut hundreds of billions of dollars in unnecessary spending and unwarranted giveaways to insurance companies in Medicare and Medicaid. So we actually believe that about 2/3 of the costs of reforming health care could be achieved through these savings alone, without any new revenue. Of course, that still leaves 1/3 of the costs in order for us to cover all Americans that we're still going to have to find a way to pay for. And the key committees in Congress are working diligently with the White House to see if we can come up with an agreement on that remaining 1/3. The bill I sign will also include my commitment and the commitment of Congress to slow the growth of health care costs over the long run. This is a separate issue, and I just want to be clear. There's an issue of how do we pay for health care reform immediately in a way that's deficit neutral, but how do we also bend the cost curve so that we're not seeing huge health care inflation over the long term that would not only make any health care reform package more expensive 15, 20 years out, but would also make sure that people who have nothing to do with the government programs like Medicare and Medicaid, how do we make sure that their costs are under control as well?